everybody. In this session, as you can see from the title, is about the reproductive rights should include childbirth accident relief measure. We're going to talk and discuss about our reproductive rights and its social protection. I would like to begin with introducing our panelists tonight. Two wonderful women OBGYN doctors, Dr. Murthy and Dr. Wang.
Thank you.
Dr. Murthy is the professor and the global health director at New York Medical College. She has been practicing medicine and public health for over 20 years in various countries. And she is now serving as the representative to UN for Medicine Women's International Association. And she also represents in the UN as a member of
the NGOCSW Executive Committee.
It's so long, okay. Thank you very much for helping us today. And Dr. Wang, she is currently stationed in Washington, D.C. She represents our health department, Department of Health and Social Welfare, as health advisor to TECO. And before this, she was the Secretary General of Department of Health and Welfare in Taiwan. And in year 2015, she is a key person in the government, oversees this law, the passage of this CARA. Thank you. As for me, I am the Executive Director of Taiwan Women's Link, which is a women's organization working mainly on gender and women's health issues. I served 2 terms of legislature in Taiwan. And tonight, I would like to talk about the very important issue of reproductive rights, which most of us are not aware of, which is worry-free childbirth. I would like to introduce the related law, CARA, which is childbirth accident relief measure. And I would like to also to share with you that we work hard for 13 years, a grant 3 years, to pushing through this legislation of the law which protects our reproductive rights. To giving birth is a very important thing. It's actually for the survival of the mankind. If women who choose to have a child, I think she should have the freedom to be free, not to worry about the childbirth accidents. What happened if something wrong occurred during my delivery? I think today here, a lot of people has the experiences of having child. Do anybody really worry about like something happened? I do. I did. When the expectant day comes closer, I start to worry about what if I did not open my eyes on the operation table? What would happen to the bad outcome of my newborn baby? So if a woman chooses to have a children, I think she is entitled to a worry-free childbirth. And this is where this CARA coming around. We talk about reproductive rights. I bet everybody here also very familiar with reproductive rights. We also always talk about the right to have or not to have children, or right to when to have children, where to have children, or how to have it. We are requesting the affordability, the accessibility of the medical service or the financial security. We also request for the safety and the quality of medical services. But very seldom we talk about the risk which might involve in a childbirth. And this CARA is the Childbirth Accident Relief Act. This is the first legislation in the world to protect women from childbirth risk. It's regulating how government look after women in event of childbirth accidents happening. Where are the risks coming from when you give birth? There are, is it hard to read? Those are risks coming from medical issues. Some are government policies. Some are from personal health conditions of the purpura. By the way, purpura is the women give birth. The risk can come from bad management in the medical system. It can come from the multi-practice mistakes or negligence among medical personnel. And there are certainly uncertainties in the medical procedure and the limit of the medical technology. And as long as for the government part, the bad policy can result in a shortage of obstetricians or medical settings in the rural area. As long as the woman concerned, she might have some conditions susceptible to certain accidents. So all this can contribute to a woman when the risk that she will encounter when she had a baby. And some are avoidable, some are not avoidable. So who are going to take the burden or shoulder those risks when the accident happened? And in the CARA, I say it's the government. Why government? People will ask why the nation is responsible for women's childbirth. Because childbirth is not a personal matter. Childbirth is more of a national and societal matter. Women give birth to the policemen, soldiers, doctors, nurses, students, teachers. Though they are the human resources of a nation. And it's also to do with the health of these people, and also the future productivity and the development of the nation. So it's very important that we take childbirth as a national or societal matter. So when a woman selfishly puts her own life and health at risk to fulfill the role of the nation's survival, the state should also shoulder the risk involved in events of the accidents happen. And what women need when something bad happened to her, well, during the childbirth, they want to get relieved. Usually, first thing they need is a consolation, make them feel better, so as to also reduce the conflict between the women and the doctors. They need compensation, because this is altruistic behavior, okay? And then also they will probably save the indication, trouble, or harm for the woman. And also, wish this thing won't happen again to other women. So this is what women need when something terribly happens to them on the table. CARA, it protects women based on the woman's need. This Childbirth Accident and Relief Act, based on the woman's needs, has three aspects. First is the consultation, which they regulate the medical system, should form a team called the Instant Care Assistance Team to help the woman. And then secondly is the monetary compensation. The government set a fund to compensate women that has a to suffer from these accidents. Thirdly, is they have to improve the medical safety and quality. So the law asks the medical system have to do the cost analysis and make a correction so as to make sure this accident won't happen again. So this is how the CARA work. The spirit of the CARA is that assigning no blame but demanding accountability. What does it mean? I'll explain later. First of all, the government set a fund called Childbirth Accident Relief Fund. And this, when something happened during the birth that is related to childbirth or unable to rule out the relationship, the government compensates para, even if it is in the hospital or at home or on the road. And the women and the medical system doesn't have to put money in this fund because they behave in altruistic manners. But for the medical system, they're not. This is where the not blame and accountability coming in. Something happened. We don't blame. We don't punish the medical system, the doctors or the hospital, but they are held accountable. They have to do what? They have to do honest root cause analysis and make correction. Only if you don't punish them, don't send them to the jail or ask them to pay a big sum of money, they will honestly, they are more willing to face the problem honestly, to do the root cause analysis and the correction. And then also here, I forgot to put a line here. The government set an external surveillance system to oversee if the hospital, the medical system doing this well. And in this act, what is covered? What the compensation covered? What kind of accidents are covered? It's about if the woman, the death of the woman or loss of infant or fetus. Okay, this is one kind. The other kind is that then we have major injuries, end up with profound disability, severe disability, or moderate disability. They were all compensated. And a woman, because of the accident, they lost their uterus, will be also compensated. And the people will probably ask, so when you get a compensation, can you still sue the doctor? In this CARA, compensation and education are mutually exclusive. It's a dual track. If you get the compensation, you don't sue the doctor. If you want to sue the doctor, it's at your will, but you don't get the compensation from the government. But if you receive the compensation and later on you change your mind, you can still sue the doctor or the medical system, but you have to return all the compensation you received. Okay. So in this way, we'll make the woman, comfort, relief, because they get a compensation, and then there will be no more lawsuits for them So they will be relaxed too. And for the doctor, because there's no litigation against them, they're more willing to tell the truth and make a correction. So the significance of this law, CARA, is about women. It's made for women. It's not made for, it's helped to solve the medical dispute. However, it's not made for resolve the medical dispute. It's for women. And secondly, it stress that the childbirth is a national societal matter, and the government and the state recognize it. Third, they set out a frame that worry-free childbirth is an integral part of women's reproductive rights and freedom. And last, it shows and proves that women's determination and perseverance can achieve greatly. And here I would like to share the experience, the 13 years journey that towards the CARA. And the background was, people asked me why you come up this kind of idea? And I say, I was dated back to 1999, when I feel very helpless and very angry. Because at that time we were trying to help 7 families. It was childbirth accidents. In one hospital, in 2 hands of 2 obstetricians. And we found, at that time, we found that the hospital has no sympathy for the victims, and they don't want to settle, they don't want to make a better settlement for those poor, suffered women. And then, so they have to go through lawsuit. And everybody knows the lawsuit lingering and very complicated, and those families, they're being victim already, and they don't have much effort to fight a legal suit for over 4, sometimes 5 years. So they end up settling very little at the end. After the lawsuit, still settling with very little compensation. And what part of, because there's a big gap of big knowledge and information gap between the doctor and the patient. We don't know much about it, so we never know the truth. So in that way, we probably also easily to lose a lawsuit. At that time, I feel really bad because the 7 cases in the hands of 2 doctors, we still cannot do anything about it. So I thought something has to be done to relieve the woman from all these sufferings. And so that started the 30 years long journey. I was so passionate because of this social justice, but we are facing a challenge. We are challenging the unprepared society. So we go through the phases of being ignored, then being seen, and finally being accepted. It starts very lonely, but it ends up with joyful tears, which is not bad. But although it was 1999, but it was until 2003 the journey began. And we start to promoting childbirth risk compensation mechanism to Taiwan Association of OBGYN and Department of Health. And this is the 2004 women's organization gathered in the Department of Health and asked the minister at the time to make measures to help women. But we're starting, of course, very frustrated because people at that time think this idea is far-fetched. Why childbirth? Why not heart attack. If somebody died of heart attack, why don't you compensate them? Why only childbirth? And then the proposal even failed to stir up the passion among the OBGYN doctors. They are also the main beneficiaries. But the idea is so new and so hard to persuade, so it started with very difficult. And then by year 2005, I became a legislator at large for the Democratic Progressive Party. And at that time, I started had the power to do work. So before, I'm nobody, so not people won't listen to you. But when you become a legislator, you are more, you have more power. And then I give lectures, I give seminars, and I write articles, and I talk to people. And finally, at 2007, the association, this is the Taiwan Association of Obstetrician and Gynecology, conducted a survey. Now the doctor welcome this mechanism. 2005, they're not enthusiastic at all, but 2007 they are now. And from the government, they are friendly, but they are not so active respond. But anyway, it's a good turn because now I have a power to do something. Wow. But in the following years, we're still struggling because I would say it's still a very new idea. And so we had to hold a lot of press conference on the Mother's Day, on Women's Day. We repeated talking about it, and something happened, like a major childbirth accident happened. We also hold the press conference to condemn there's no such system to help women. And even the doctors, they come out now because at that time, Taiwan facing few children problem. That we have not all the women want to give birth. So we have a very low rate. What do you call it? Fertility rate. And also, the gynecologist facing, the obstetrician facing the childbirth accident because very much, and they have they actually every accident happens, they have to involve two lives, so they don't want to become obstetrician. So we are short of, our obstetricians are getting old, and which is very bad for women. Very bad. And so at that time, with this kind of social background, the association come out and say, President, if you don't move on, then we're moving away. This is how the doctors' press conference. And so in year 2012, which is about 9 years later, they come up with a substitute. They do a pilot plan, encouraging medical institutions to implement childbirth accident relief mechanism. When you see this title, you know it's encouraging medical institution, and it was funded by existing fund, which is for some purposes for something else. They steal the money from there and put it here. But this is not what we want, because it's the plan is about a monetary subsidy of hospital settlement with the patient. It's not about women. It's about solve the medical disputes. And some women are unable to receive. For instance, if the accident occurred at home or on the way to the hospital, they cannot get it. And if the medical institution is not joining the plan, they cannot get it. And also, it's not sustainable because it's just a pilot plan. It doesn't have a statutory fund. And so up to the decision making, they want to continue it or not. So we decided legislation is the only route. So when I was still a legislator, I proposed this law, but it was political boycotted by the opposition party. And then by the year 2012, another woman legislator she is also representing women, and he proposed another draft. Sorry. And so it seems like it's going to go from here. However, there's an exception of general medical accidents. The government is okay with a childbirth accident relief plan, but they were thinking more. They want a bigger plan. They want a general medical dispute resolution and the accident compensation act called the MACA. Okay, they want to use this to cover the childbirth accidents. Well, I mean, I can understand their stand from, but this is not what we want, because this is still about solving the medical disputes. It's not about women's reproductive rights. So, but fortunately or unfortunately, early 2015, most doctors oppose it very strongly because the doctor doesn't want to pay for the fund. But in this law, the doctor has to pay their share of the risk, right? But in ours, because we are altruistic behavior, so the government will pay everything. So they don't want to pay the fund. So MDR MACA did not work. So did CARA. So it's all dead. That was 2015. And because that's it's election year, so nobody want to anger anybody. So the law was just lying there. It's not moving. In the summertime was hot, and I and my the office Secretary General, we were feel sad and helpless. And one day, late in August 2015, the TOAG Secretary General suddenly called. He said, let's push the legislation again. It's in August. But in December, the legislature's term, from September to December, this is the last session of the legislature's term. And so, and it's a session for reviewing budget. So there's actually no time for law to pass. So we have to work out how to do it in less than 2 months' time. So what we do, we have to overcome the obstacle of the opposition stemming from the earlier law. And we have to avoid the partisan bickering. So what we do is that we take this law, we revise it to our need. And we give it to different parties, like the DPP and the other party. So both parties are happy because they all have represented, they all get credits. So there's no fight. So it's safe, it's party balanced. And then, of course, there's a time constraint. We use a lot of technical strategy to overcome this time constraint. And so, in 2015, December 11th, we passed the law. So let's say that this is the CARA. We made it. We're so happy that we did it. So it's 2.5 years now. We want to see the law we passed. It's really help. First we'll see if the care and the assistance is women satisfied with the care assistance from the hospital. And 80% of recipients, which means the one that receive the compensations, they're satisfied with the care they receive from the institutions. Used to be the hospital usually show no sympathy, so it's very frustrating for the women have problems. So now they're 80% satisfied. And 85% agree that doctor-patient relationship improved as a result of service provided by the medical institution. As earlier I said, they have to set up a team, incidence care team. So this team really helped those the patients. And about the litigation, from 2011 to 2017, assessment case related to OBGYN litigation decreased by 60%, which means there's a big drop of litigation on the obstetrician cases. And in 2017, there's only one case. The lawsuit is only one case, and this case is because it doesn't meet the criteria of this law. And as for the professional environment, the recruitment rates for the OBGYN resident doctors grew from 60% in 2010 to 100% in 2017. Okay, of course, this is not the only reason that they raised, but this is very major because there's no, if they don't have medical disputes, this would be a heaven, huh? Yeah. And then about the safety of medical service, do they improve? Well, they do report for the accidents. When the childbirth accident happens, they do report. Okay, this is good. And then we review the child accidents, and we have suggestions. And so the medical, the training course use those cases to teach the doctors. And so, well, everything is, the outcome is still have to watch, I mean, to see. But when people asking me, assigning no grant but demanding a complete, does it work? If the doctor really, because of this law, they honestly, review if there any wrongdoing or their own and do the corrections. And I think it remains to see, but I'm very optimistic about it. And second, is the amount of compensation satisfactory? This is a very difficult question, but I have proposed a review on this and to raise the compensation, okay? And it's being reviewed now. As for, I'm here to talk about this issue. I think it's not only the problem in Taiwan. Actually, we have very low mortality or morbidity rate of mother and infants or fetus. The world mortality rate in 2015, according to the World Bank, infant rate is 1,031.2. Maternal mortality rate is every 100,000 is 216 across the world. And I would like to see when those things accident happened, the woman and the family get relieved. So the childbirth, the risk of childbirth won't go away. No matter how good the medical technology advanced or how comprehensive the public health is implemented, they will have risk. And this is going to happen. But I would like to address this important issue. Childbirth is not personal. It's national and societal. So the government has to do something about it. I'm not talking about every country now has to compensate the sufferer, but at least acknowledge the childbirth is a societal, national thing, that would give more thinking about not only childbirth, but also child caring and maternity leave or child caring leave, all kind of things. So here I would like people attend here, they will take up the issue and advocate in your own country. Thank you.
Yeah.
Now I would like to ask Dr. Wang. She is in the government at that time, in the Department of Health and Welfare at that time, and she's overseeing the passage of this law. And I would like to know from her how they view us. Are we a bunch of women who just want the candy all the time, or how do the government actually react to these things? Maybe some secret.
Thank you, Shuin, for inviting me here. I'm so honored to be here. To be honest, this is my great honor participating in this giving birth of this new law. I'm so honored to be a partner at that time, working together with Wang Shuyin and also the Taiwanese Association of OB/GYN. That is one of my major achievements during my term of the Director General of Medical Affairs. As a woman, as an OB/GYN doctor, I'm really feel so honored. And right now, I want to borrow your hands to give a big hand to not only Wang Shuyin, but also a very important, the only man in the classroom. In the room, he's not Adam. He's not Adam. He is Simon. So please stand up and everybody please give him a big hand. Why he deserves it? I think you know everything. And yeah, I'm so lucky. During from the very beginning to the end of the law, 2012, at that time, Taiwan Medical Society suffered from a high percentage of medical dispute. At that time, we have a medical dispute or medical litigation number. It's doubled from the number of 20 years ago. So it's a very big high number. So at that time, doctors don't want to be a OB/GYN doctor, don't want to be a surgeon because too many medical disputes. After 2012, we initiate the pilot program of the birth compensation. Immediately after that, we observe the decrease of the medical dispute. And we also observe the increasing number of the OB/GYN doctor. So 3 years later, we have a will to establish the new law. And the new law, actually, we have to trace back 30 years ago. 30 years ago, at that time, Wang Shuyin initiated this idea. So from the very beginning to the end, everybody in this room, you know that it's not an easy job. Although it needs the partnership, alliance from the government, OB/GYN doctors, and also the Women's Society, but sometimes we need a strong will from a woman who insists everything, who insists her belief, no matter the circumstances is how bad the circumstances is. So it's really a wonderful job. She really did a wonderful job, and it's really an amazing story, isn't it? Yes. So please give her a big hand again. Okay, this is Taiwan story, but how about US? How about Minnie is also the representative of the International Medical Women Associate. So please say something.
Thank you. First of all, thank you so much, ladies, for still sticking with us, even though it's like 7 o'clock. And I think I join you, Joyce, in giving Sue and your team a big shout out, because this is the only country which has this law. And I can, I just wanted to talk a little bit about how what you have done can be linked to the SDG 3, 5, and 17. But before that, unfortunately in the US, so many people have stopped practicing OB because of the horrible malpractice suits. So this law is really nice because it does not kind of make, there have been instances of physicians like losing their license or worse, killing themselves because they're so depressed. And let me tell you, as a physician, you make the best choice then, hoping it will turn out for the best. And again, no physician is divine. I mean, we're all human. And I'm not making excuses, but you try your best. Sometimes there are so many cases, as to why it goes wrong. But just in answer to your question, Joyce, unfortunately, we do not have a law like this, and we have a very high malpractice insurance. So many of us, including myself, even though I haven't had a suit, thank you God, we do not want to practice OB anymore. So down the road, unless there is a social protection, that is the theme of the CSW, not only for the women, but the doctors too, and the infrastructure, we cannot really do our best. So I think this is really good. And I just wanted to, shifting gears, I think this addresses very clearly the SDG 3, which is universal, which is care for all at all ages, and especially the thing 3.1, when we're looking at the targets, the indicators, because the 3.1 is by 2030 to reduce maternal mortality, and by having to 70% ratio to less than 70 per 100,000. So I think this really does help to achieve that. And also, this is a great example of a best practice. And thank you so much for sharing it. Like I already sent the electronic version to so many people, and they go like, really? I go like, yes, really. You got to look at this and see what can be done. And also the other thing is, I think it also kind of illustrates how 3.2 can be met, because that is to end the preventable deaths of newborns. And if you have something like this, it also increases accountability for all the stakeholders. And also it does fit into 3.8, the target of the SDG 3.8, because that is achieving universal health coverage and accountability. And as we know, this year the UN, the President of the Secretary of the General Assembly has made a universal health care a big push, and it is going to be a high-level forum. And next month also there is a meeting. Those of you in New York, I think the email notice is going to come next week, that there is going to be a session for all stakeholders at the UN about universal health coverage. So I think this really ties into that. And also the other thing is that we are talking about SDG 5, because you're empowering the women. So this really links up with the SDG 5, what you have been doing. And also, especially with the 5.6, the goal, the target 5.6 in SDG 5, where you're looking at violence against women and to empower them. So I think this really, and as we know, the theme of this year's CSW, ladies and gentlemen, is social protection, public, public services and infrastructure. So this law really does, because you have the social protection of women and you have the public services, because the government is providing the public services and infrastructure. And also, last but not least, goal 17, because it's capacity building. I mean, you just so beautifully said how your department works. So you see, it was working with the health department, working with the legal, the lawyers, and also I'm sure there were lawyers involved to get the drafting of this, and also with the legislators and NGOs, and also the physicians. So it is really a great example of global partnerships. And the other thing I just wanted to say, that it is really fascinating that it took so long to get this through. And let me say, I mean, no disrespect to you, sir, as a man. I've been married to one of them for more than 30 years, and my husband just listens. And sometimes when he talks, like we all turn off when men talk, because but what I just wanted to say, if a man gave birth, the law would have been passed a long time ago. So you see, no, seriously, there is discrimination in that, you see. And why do you think? So this is what I just want to ask about, if we could have a little dialogue. What do you think happened when suddenly one day did they wake up and think that, yes, we have to get this through? So I'm just wondering, what is the political mechanism behind it? There must have been something which got this rolling. Because we all try, like here in the United States, to answer your question, and for those of us who are visiting New York from other countries, is we have been screaming, by we I mean a bunch of us physicians, for a single payer system. Because the problem we have all these insurances, and one insurance will say, okay, I can do this test for this patient. The next insurance will say, no, I can't do the test. So half the time, if I am seeing a patient, myself and my staff, we are fighting with the insurance companies to get this going. So now, so we have been fighting for a single payer system, which hasn't yet come through. So maybe we need to take lessons from you guys, what you did to get this moving. So what I'm trying to say, I understand the blood, sweat, and tears which went into it, but I really liked when she showed us here as to what the outcome is, because you had the monitoring and the evaluation too. But my question, which I would really like to bring it back to both of you and then hand over the mic to you, and maybe you want to get, ask the audience for questions, is what do you think, because both of you were really active in this, what one thing or what things were so crucial in getting this passed? So that is really, to me, when you first reached out, and when I read it, I go like, what happened? Because I was following the timeline, like what happened? I'm sure everybody in this room is curious to know. And also, you know what, Taiwan is really awesome. I mean, I love you guys, and I love visiting you. But I'm trying to say, I mean, the social protection services you have, and the way you're working to meet the SDG targets, especially SDG 3 being held, and also which is linked to the SDG 5, I think is really awesome. So what do you think happened? I'm just going to pass the mic back to you. Which
to me? Or
yeah,
to
no, to you first, and then to Sue,
okay.
To see, like, because you were in the there when in the Department of Health. So what happened? Why was there such an interest to get this going? Thank you.
As I just mentioned, 2012, we have very difficult circumstances. The medical dispute is so high, doubled the medical dispute, and the resident application is health. But after we tried this pilot program, after 3 years, we actually observed the double number go back to the number 10 years ago, meaning that decrease 30% off the number. And the resident application is doubled. become the original number every year we offer to the OBGYN slots. So answering your question, my thought is if a woman's matter could be a society's matter, or a woman's responsibility can equal to a society's responsibility, then actually we move forward. We are more close to a civilized society. So, like this case, if the woman's duty, responsibility is giving birth and also taking care of the child, if that responsibility and that duty are recognized as everybody's duty, the whole society's duty, the governments have the duty to change the environment. That would be different. That's your thought. If that is men's duty, that would be different. This year's OBGYN meeting, annual meeting in Taiwan, we just had the meeting this March. And we have distinguished guests from US. We actually have the immediate past president of American OBGYN Associate, and also the president-elect of the International FIGO, International Association of OBGYN. They all came to Taiwan to attend the annual meeting of OBGYN, and our President Tsai Ing-wen met all these distinguished guests, and she urged our National Health Insurance Agency to raise the reimbursement for the OBGYN, for the obstetric care. So I think that's we can say now we already move forward, and maybe there are still some or many we have to improve, but not only the law. Actually, our society put our women's issue as an important issue right now. But this issue, I think, Huang Shuying, you are an expert. You can say something to answer Minnie's question.
It was a long 13 years, and every moment is critical. The most important element, I would say, just not give up. And actually, in the 13 years, there's a lot of hard, broken moments. For instance, I will show you the pictures. Huh? Okay.不搞，这个医生的那张，那个不是在后面。在下面，哦，这张。Yeah, you can see this one. Oh, it's cool. And not giving up is very important. But then this time you also have to, with the help of the environmental change, because when 2000, early 2000, 2003, the low infertility rate is not so sharp, rising up so sharp, and nobody mentioned about our OBGYN doctors are getting old. So at that time, people did not pay too much attention. But then when the general environment getting worse, people start to look at this issue, and they start to listen to you also. Look at this one, and then this is when the pilot plan starts. They use this one, and it solved the doctor's problem. So the doctors are very happy at that time, and they were happy that we had this plan going on. But this is not what we want. So at the one point, it's all switched to different thing. It's not about women. It's about solving the medical dispute. And so we are not happy. So we hold a press conference, say this is not what we want. So things like this at the very beginning, we and the doctors are holding hands in hands, and then when they get what they want, they drop your hands and they go along. But finally we got it back. You know, it's nice that we work together again. So also, very important, you have to realize the political environment. Very important. First time when I proposed the law, at that time we are the government is DPP. So the opposition leader, they are holding the majority of the seats in the legislation. They don't like it because they don't want us to get credit. So they just sabotage your law. But then next year, the 2016, it's the KMT took the government. The things start to change a little bit, but still, at that time, government liked the idea we have, but they were thinking big. They want a general medical dispute act, which is entirely different from what we want. And but for some reason, the doctor doesn't like it. So at that time, I remember Dr. Wang was under a lot of attack because they proposed this law for the general medical dispute. Yeah, but actually, we don't like it. But if that's the case, it was covering the childbirth accidents, which we have no choice but to accept it if that's the big environment want. And so, but unfortunately it doesn't pass. So we were able to push our own again. And as I say, not only the political environment, you need to have somebody do something in the nick of time. That the General Secretary General from TO, from the association, OBGYN Association, he suddenly called, say, well, let's do it. Because this is the last session of the term. And next year, if they start the new legislators, so everything had to start all over again. So he goes like, let's do it. And we think he is being stupid because that's really mission impossible. It's mission impossible. So after 30 years, we pushed for the law, and it ended up in 2 months review. From the last 2 months, they reviewed it and passed. Was just set a record, right? 30 years hard work, 2 months review. But fortunately, because in the middle, in the 13 years, when I say every moment is important, because we were doing a lot of lectures, doing seminars, we write articles, we talk to people, we have to talk to the social, the non-profit organizations. They are also in the similar medical, they're caring about medical area. We have to talk to the Doctors Association for them to support. So it's a lot of work, but since I'm getting old, and I lose my memory easily, so I forgot how hard actually it was.
Thank you. And I think one more thing I just wanted to add, it's definitely a human rights issue, because childbirth is a human rights issue, and it's also a question of equity here. So those two things were also recognized. I mean, like you can see all over, like the lack of access to contraception, or to reproductive health services and safe motherhood. Even in this day and age, we have over 376,000 women die in childbirth every year. And most of these happen in the South or the low and mid-income countries, where there is, you can see, such a disparity because of the social determinants. But I think once we all realize that women's health is a human rights issue, and it's linked to the social determinants, I think we can move forward. And as you said, it was also one key thing which struck me is when you said the doctors were also, this was the first time in so many years when they were facing so many disputes. So all these things, it was like what we call the snowball effect, but the outcome was very good. It was a snowball effect and the avalanche, which resulted in something positive. But I think you should be so proud of it, both of you. And you know what? I feel so privileged to be sharing the podium with you, to be discussing this. And I think it's great work they have done for women. And I'm just going to turn it over to you if you want to have some Q&A. Sorry.
But I like a word, he for she.
Yeah, he for
Women
she.
together, we can do lots of things, but we need men to support us, to work with us. I like he for she. And your conclusion? This one.
Well, let's have some, if people have questions,
I was curious what the gestational stage is when this happens. Like if a woman goes into labor early, say at home, would it still be covered in this, or is there a certain gestational stage she has to get to?
It's about women. It's meant for women. It's about the childbirth risk of women were encountered.
Okay.
So it's when you are about to give birth, if this is birth related, no matter how it happened, where it happened, it will be compensated. Which means if you before you have a labor and then before you can reach the hospital and you deliver the baby in a taxi, okay, and then something happened, you will get compensated.
Okay, so there's not cases of abuse where somebody is in poverty maybe or has a drug addiction and something goes wrong and then they use it to get money? Does that ever happen, or is that not really an issue?
Well, we haven't happened. Yeah.
That's good in your country. That's good. I wonder if in America we could be vulnerable to that. So that was.
Well, let me tell this. Even they are under opium or stuff like that. A woman get pregnant, and then if they have some bad outcome, I still think she wants to give birth to a child, to the society, to herself, or to the society. And because of this, she still should get compensated. We don't ask anything. This is a non-blame measure. Yeah, it's a no blame. So if we don't blame doctor, please do not blame women either. Yeah.
Yeah, I mean, I agree with you too. I wanted to make sure that nobody would intentionally do this because maybe a woman's in a desperate place where she needs money, and so could it create a system where she would intentionally induce labor, or even a spouse maybe she would be vulnerable and he would abuse her so that they could get money if the baby died.
Yeah, I am aware of this kind of moral risk, but it's not happening yet. It will happen afterwards. I don't know. But even it happened, I think this will be a very rare cases where we shouldn't, because of those cases, hurt other women. Yeah.
I can add something. The moral hazard is always our concern. So the mother's death, the compensation fee is $6,000 USD. 60,000 USD. Not so high. because newborn is so vulnerable, so we need to concern more moral hazards. So for newborn death, we compensate only 10,000 USD. We don't want the compensation fees too high.
To be incentivized.
Yeah. So we lowered the compensation fee. Yeah. Thank you.
I think compensation is a very tricky thing. You think about women's life, you get very low compensation. It's like their life and their effort is worthless. So we have to rethink about how we compensate women's deaths. This is the issue I'm raising up right now, because I think to compensate women's deaths for $60,000, maybe $63,000 US is way too low. Yeah.
Can she also have private life insurance as well?
I was about to say that.
She can.
Everybody can have their own insurance.
Yeah.
Yeah.
And this is
But I don't know if private. I don't know how it works.
if it's
You know,
the other.
they are independent. They are independent. They can. If she has that, then she has that. But if she has this one, then she has this one. Yeah.
And then I'm assuming, excuse my ignorance about the Taiwanese system. Do you have universal health care in Taiwan? Is it all government funded? It's single payer? I'm trying to understand.
We have a national health insurance. Government pay everybody. The stakeholder pays, the government and the insurer. The user. Yeah, and I think what else? And the boss, the employee.
But it's a national health system.
Yeah,
like
yeah.
a
Then,
single
yeah.
payer.
A single payer,
It's a
national
single payer.
government-run
Okay.
single payer health
Okay.
insurance
So it's
system.
basically
But then everybody has to
national-
chip in. Everybody has to pay insurance premium.
Not really the
Okay,
tax.
okay.
Yeah.
We also have independent.
Yeah, population also need to pay the
commercial.
premium.
Huh?
We also have commercial health insurance.
Oh yeah.
So it's-
Sorry,
Okay.
I came in a little late, and I find the topic fascinating. You know,
Fascinating.
and I kind of want to follow up on your question about the possibility of abuse of a system. What mechanisms are in place to ensure this? This is new territory for me personally. I'm the chair of CEDAW, and I'm very deep in New York City, and I'm very interested in what you're talking about. And I'm also a journalist, so this is something that should be made rather public. Besides, I want to move to Taipei because so many things are happening there that are good. So, what if I'm a Taiwanese and something happened with my pregnancy? The government is going to give me $60,000 because something happened with the baby, right? Which could have happened in the home through a fall or something like that. Am I right? Is that what? Sorry, I came in late.
It has to be childbirth related. If you fall from the chair and then you lose your baby, in this law we don't cover that. We don't cover that. Because it's a pregnancy, through pregnancy and the delivery is 10 months. We only cover now the from 33 weeks. 33 weeks for the babies and fetus, and then I think it's from 28th week for the mother. Yeah. When you see this, because we have this system going, so all the hospital have pregnancy related or childbirth related accidents. They have to report to the country, to the national government. So government has all these numbers. We can see from the numbers. We know at the early pregnancy up to 37 weeks, not much thing happening. But after that, there's a huge rise on the accidents. It's all childbirth related. Yeah. If you were born with a pre-genetically problem, the child died, we don't compensate that. It's childbirth related, or we cannot rule out the relationship to the childbirth. Yeah.
I have a question for you. What about due to any medical complications of pregnancy, like fits, like due to high blood pressure? It occurs in the 3rd trimester. So would that be covered too? If there is a fetal loss or there is a maternal morbidity, I mean, she doesn't lose her life, but she has like other issues, and so because of that, so is that covered? She loses the infant, but again, she's in the 36th week or 34th week of pregnancy, not in the 1st trimester, but then what happens? The medical cause. And as we know, some of the causes come during pregnancy. Like she might not be hypertensive before, but she can get hypertension, and you had that in your slide, and so she can have fits, or she can have abruptio, or placenta previa. All these are exclusive conditions during pregnancy. So all these are included, right?
Yeah, as I say, it's a no-blame compensation.
Okay.
We don't blame doctor, we don't blame women. If a woman has high blood pressure, still want to go through this, she's very brave and risking a lot. So I'm not saying that we're encouraging her to, but she just have to have a good care, then she'll have no problem. Even women have a heart problem, they still can deliver baby very well. And anything related to childbirth, or you cannot exclude the relationship, then you'll get compensated. This is what I say. It's about women's reproductive right. They should be worry-free about childbirth. Yeah. And this law is made for women, and it helps solve the medical dispute.
Excuse me.
Yes.
That these complications of possibly hypertension and diabetes, for instance, comes on during pregnancy. The stress on the female body depends on who that female is. That these things can be a part of pregnancy-related issues. So is that covered? I don't have diabetes and I don't have hypertension, but I get pregnant, and suddenly all of this is happening to me.
Well, at this time, it's not, because it's a pregnancy-related problem. It's not childbirth-related, and it's not a major injury. It's not death. The reason we only cover this because we have to also consider the size of the fund. The fund. We cannot cover everything right now, but it doesn't mean that we won't push through the entire pregnancy to get compensated if something happened even during the pregnancy. But for now, it's only to do with childbirth.
So what about now, do you have any provision in this fund to cover the medical expenses? I know Taiwan has a national health scheme, right? But suppose it's a woman who can't afford to pay that 1% or 2% or whatever she's supposed to pay the premium. So suppose the medical conditions which result which she needs attention even after the pregnancy is over, this fund won't cover it, right? Because it's only limited to the childbirth and not even the 6 weeks after the childbirth, right? Because that's what we call the perpural period. You're an OB, so it's the same thing in any country, the 6 weeks postpartum. So I'm saying that suppose anything happens then to the mother, is it covered?
No, you have to prove that it stemmed from the childbirth.
No. if it's proved it stemmed from
Yeah,
the child.
then you can, yeah, because if you actually, like, for instance, because of the amniotic, how do you call it? The
Fluid.
blood, 出来的那个羊水栓塞
Embolism.
the embolism.
Amniotic embolism. Oh yeah.
Yeah, and then you probably got the kidney failure. You have to go through your life and do it. You get compensation. As I said, if you lost your uterus, then you from then on you lost your childbirth ability, so you get compensated. But it all depends. How much you compensate depends on how many kids you have right now. Yeah. Yes.
Well, I just wanted, hearing, first of all, let me say, I'm an acupuncture doctor to focus on OBGYN, men's reproductive health, as well as psychiatry. I'm from the beautiful islands of Trinidad and Tobago, but I live here in Brooklyn.
Yeah.
In fact, I just flew in from Trinidad and couldn't fly because of the Boeing mess, the 737 MAX 8. So I had to postpone the flight to come back and try to get a different engine.
They're all banned now
Yes,
for some time.
I flew in last night. But what I want to say is that this is so enlightening. It is so positive, forward moving, that it took me right back to my daughter in 1999. She was having her first baby, just finished her pre-med, an otherwise healthy young lady, track and field, ballet, music, very healthy. At 8 months pregnant, I was in Brooklyn, and her in-laws called and said that she had collapsed in the kitchen. Her husband had gone back down to Miami to finish his master's. When they took her to the ER, they kept her there languishing in the back until her father-in-law, who is a physician, came and they rushed her in. To cut a long story short, her tummy was very big, and all of this happened during childbirth. So they had to take the baby, and she remained with a big tummy. Doctors didn't know what was there. She got 2 blood transfusions. The blood disappeared. She suffered a stroke to her right brain. She had a grand mal seizure. Her blood clot went down to 3. Her heart rate dropped. She had a severe case of pneumonia and was on death's bed during childbirth. To cut a long story short, we rushed down there and they had emergency surgery. What was in her tummy and that was killing her was a tumor the size of bigger than a basketball.
It was a fibroid which grew
27 pounds. It grew out of her left ovary. So she lost the ovary. They took the tumor out. They cut her from top to bottom. This is no joke. When I went to see when they sent the pictures out, you were seeing all her organs, because it's like when you cut a chicken open and you pull it back. The tumor, you could see the root of the tumor coming out of it. Was awful. They took the tumor out, did what they had to do, but she remained with seizures. So all of this happened during childbirth. She will have 10 seizures a day. That went on. She could not forward to medical school. Then she finally went to medical school and had to exit because the seizures continued. And that happened during childbirth. It was quite a thing for me and my family, I can tell you that.
That's a rare complication.
I got very ill.
Oh.
Eventually, the doctor said she has to have brain surgery to stop the seizures. So they took the hippocampus from her right brain. The seizures continued. So what really helped was the acupuncture that I would go down there from time to time to help her, and all the Chinese stuff. I think she still gets some PT mal.
But she's not grand mal. So
she's not grand mal anymore, but that took 20 years. Because that boy, the baby boy that she made, who was just 2 pounds, he is now 20. He was born on the 19th of June, or the 21st of June, 1999. He's a solid man,
Oh,
like a
wow.
football player. But it certainly debilitated my daughter. She is a fighter. I think she's doing a PhD and may want to go to do her OBGYN. That's what she had planned to do.
Wow.
But what I'm trying to say is that she never got 1 penny from anybody. There was absolutely no compensation.
Yeah, because the insurance in the United States is not going to cover that. It will only cover, but see, we don't have cattle here. So maybe if this, I think what
If this had happened in Taiwan, she would have been
she would have been
compensated.
covered, right?
They sent her a bill for $120,000 for their child, for the delivery. And then the brain surgery was about $20,000, which of course they couldn't pay. They were a young couple. They couldn't pay.
This is
Yeah.
All meetings
So I'm thankful for this.
Just a reminder,
Okay.
And I am going to advocate for
should
this.
be backing up in 5 minutes. If you're in a meeting right now, please don't forget your belongings, your coats and cell phones, and scarves and hats.
Well, I think we have to end this session.
Thank you very much.
And do you have anything you want to say more?